what is metabolic syndrome and the criteria. This criteria is a standard criteria. It is NCEP ATP 3 criteria. It is according to the guidelines. So metabolic syndrome or syndrome X. Metabolic syndrome is also called as syndrome X. It is diagnosed when a person has three or more of the following five conditions. Okay, so you have to remember this guideline. Number one is abdominal obesity. If abdominal obesity in men is more than, waist circumference is more than 102 centimeters, or in women it is more than 88 centimeter, number one. Number two, triglycerides are more than 150 milligram per deciliter. Number three, HDL, the good cholesterol. HDL is called as good cholesterol, is less than 40 milligram per deciliter in men and less than 50 mg per deciliter in women. Fourth is blood pressure. Blood pressure is more than 130 by 85 mm of Hg. And the fifth is fasting glucose, which is more than 100 milligram per deciliter. So they are the five criteria. If someone is having 3 out of 5 or more than 3 out of 5, 4 out of 5 or all the 4 out of 5, that person is having syndrome X. Syndrome X, also called as metabolic syndrome. And syndrome X, please write down, it's very important. Syndrome X plus obstructive sleep apnea. If someone is having problem with the when he is sleeping and they're having some snoring problem, it is called as obstructive sleep apnea. Is called as obstructive sleep apnea is called as syndrome Z. There is a criteria of diagnosing obstructive sleep apnea. In medicine, it will be taught in detail, but for your physiology purpose, at least remember syndrome X or metabolic syndrome if someone is having more than 3 criteria out of these 5. Okay, and if someone is also having obstructive sleep apnea, it is called as syndrome Z. So this is the criteria when person is having metabolic syndrome. Now that person can grow in diabetic person, that person can grow in cardiac patient. So it is the same soil from where multiple diseases are emerging. So we must be well aware of this, that we should not have metabolic syndrome. So as a doctor and as a medical student, we must be aware of this.